So today our discussion topic is Glasgow coma scale or GCS scale. So it is very popular about the name of GCS, GCS scale, and it is very important for assessing the patient's condition, whether it is mild or moderate or severe condition of this patient. So this is formed by three components. Those three components are eye opening, and verbal response and motor response, and by these three name this is also called EVM. So this is about E4 V5 M6. Why it is called E4 B5 and M6? Because in this eye opening there are four of the highest score is about 4, and in verbal response the highest score is 5, and motor response the highest score is 6. That's why this is also called E4 V5 and M6. So number one is eye opening. So eye opening, so if the patient can open his eye spontaneously, that is called spontaneously, that is the score is 4. If to the verbal command, then the score is 3. In painful stimulus, then it is 2, and do not open 1, and not testable, then it is empty, not testable, because if any pack over his eyes, so that is not testable. That's why those part is called not testable or empty. So eye opening spontaneously 4, to verbal command 3, to painful stimulus 2, do not open 1, and not testable empty. Then verbal response, if the verbal response is normal oriented conversation, if the patient can oriented patient conversation is normal, that is score is 5. If he is or she is confused, then 4, inappropriate words only 3, and sounds only 2, and no sounds 1, and if not testable, that is called empty. Whether the any endotracheal tube is inserted, then the verbal response cannot be calculated, that is called empty or not testable. Then motor response, if obeys command, if the patient obey the command, that is 6, then localize to pain 5, flexion 4, abnormal flexion 3, extension 2, and no motor response 1, and not testable, then that is called empty, not testable. So the motor response is 6, and verbal response is 5. 6 plus 5 11, and eye opening is 4. So 11 plus 4 is equal to 15. So maximum value of GCS cycle is 15, and the minimum value is 3. Okay, so if, by this calculation we can calculate the patient condition is mild, moderate, or severe. If the calculation result is 13 to 15, then that is called mild injury. If it is 9 to 12, then it is called moderate injury, and if less than or equal 8, that is called severe injury. Okay, so it is very important, Glasgow coma scale is very important.